Good morning, Mr. Lai. How are you feeling today?
早晨，醫生，我今日好好，你呢？
I'm also doing well. Thank you for asking. So, we're here today to discuss your upcoming colonoscopy. A colonoscopy is an endoscopic examination of the colon and rectum. We use a flexible tube called a colonoscope, which has a fiber optic camera on the tip, to examine the inner lining of your large intestine. This allows us to detect polyps, inflammatory bowel diseases like Crohn's disease or ulcerative colitis, and colorectal cancer.
個腸鏡係點樣入去？
The colonoscope is about the thickness of a pen, and it's inserted through the anus and advanced into the rectum. It moves through the entire colon to the cecum, which is the beginning of the large intestine. We may also insert the colonoscope through the sigmoid colon, which is the last part of the colon before it connects to the rectum. To get a better view, we inflate the colon with carbon dioxide or air, which can cause discomfort or bloating for a short time.
過程中我係唔係清醒？
You won't be fully awake. We'll give you intravenous sedation, usually propofol, to make you relaxed and sleepy. Most patients don't remember much of the procedure afterward, and you won't feel any pain due to the sedative and, if necessary, analgesics we administer. It's important for your safety that we closely monitor your vital signs, including blood pressure, oxygen levels, and heart rate during the procedure.
程序需要幾耐？
Typically, a colonoscopy lasts about 20 to 30 minutes. Afterward, we'll monitor you for a short period as you recover from the sedation. Most patients are able to go home the same day.
照腸鏡有咩風險？
Like any medical procedure, there are some risks, though they are rare. The primary risks include bleeding, especially if we perform a biopsy or remove a polyp. There's also a very small chance of perforation, which is when the colon is accidentally punctured by the colonoscope. Infections are uncommon, but they can occur. If you experience severe abdominal pain, fever, or heavy rectal bleeding after the procedure, contact us immediately.
做腸鏡檢查之前有啲咩準備要做？
Preparation is crucial for a successful colonoscopy. You'll need to undergo bowel cleansing to remove all waste material from the colon. This involves drinking a bowel prep solution that will induce diarrhea and clear out the intestines. You'll also be on a clear liquid diet 24 hours before the procedure, which includes clear broths, tea, and water, but no solid food. Avoid any liquids with artificial coloring, particularly red or purple, as they can mimic blood and interfere with the procedure.
可唔可以飲咖啡？我每朝都要飲咖啡。
The meaning of clear liquid is that if you pour the liquid into a glass, you can see what's inside the glass. Coffee and milk are not considered as clear liquids.
如果我唔跟足準備嘅指示會點啊？
If your colon isn't adequately cleared, it can lead to poor visualization. Incomplete bowel preparation means we may not be able to see certain areas of your colon, which could lead to missed diagnoses. In some cases, we may need to reschedule the procedure or perform it again to ensure a comprehensive examination.
喺檢查當日有啲咩需要注意嘅？
On the day of the procedure, wear comfortable clothing. Make sure you've arranged for someone to drive you home, as you won't be able to operate a vehicle due to the sedation. Avoid taking any blood thinners, aspirin, or NSAIDs for several days prior to the procedure, as they can increase the risk of bleeding. We'll also review any medications you take to ensure it's safe to proceed.
結果幾時會知道？
We'll discuss any preliminary findings with you immediately after the procedure. If we take biopsies or remove polyps, we'll send those samples to the lab for testing. This can take a few days, and we'll follow up with you once we have the results. If we detect any suspicious lesions or find early-stage cancer, we may schedule further tests or refer you to a specialist.
檢查之後會發生咩事？
After the colonoscopy, you may experience mild cramping, bloating, or gas from the air used to inflate your colon. These symptoms typically resolve within a few hours. You may feel a little groggy or disoriented due to the sedation, so it's important to rest. Resume a normal diet and activities the following day, but avoid alcohol and driving until the sedation wears off completely.
腸鏡係唔係1年1次？
No, it's once every 10 years. If we find any abnormalities during this colonoscopy, we will perform it more frequently.
係唔係而家約時間啊？
Someone will call you to schedule the appointment.
頭先唔記得問，活檢係咩？
Biopsy means a small sample of tissue is taken from the body to examine it under a microscope for signs of disease.
多謝醫生，你已經解答晒我所有嘅問題。
You're welcome, Mr. Lai. We'll take great care of you during the procedure, and if you have any concerns before or afterward, don't hesitate to reach out. See you soon.